Hi, everyone. It's the top of the hour, so we'll get our session started. Thanks so much for coming to Cybersecurity in the Rural Health Landscape. My name is Erica Lake, and I'm the Health Sciences Librarians Outreach Specialist for Region 6 of the network of the National Library of Medicine, and I'm going to be your host today. Let's see, we do have just a few informational items to cover before we get to our presentation. Everyone's microphones have been muted to cut down on background noise, but we do welcome your questions and comments in the chat at any time. We will queue up your questions as they come in and save them for our speaker to address at the end of his presentation. We do have closed caption available, and that is, you can get to that by clicking on the icon at the bottom of your screen with the 3 dots and then selecting closed caption. We are recording today's presentation, and we will post it on NNLM's YouTube channel in 1 to 2 weeks. At that time, everyone who registered for this session will receive an email from us with a link for the recording, so you can keep an eye out for that. This webinar is eligible for Certified Health Education Specialist Continuing Education Contact Hours. You'll be able to claim this through the evaluation link that we share with you at the end of the session. And speaking of that evaluation, your feedback really matters and it helps us improve future training. So please take a moment to complete that. Since some of you might be first-time attendees to one of our webinars, I'd like to share just a few words about who we are. NLM, the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is the education and outreach arm of NLM. Its mission is to provide all U.S. health professionals with equal access to biomedical information and improve the public's access to information to enable them to make informed decisions about their health. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities. You can learn all about us by going to our website at nnlm.gov. So today's session is part of the 2024 NNLM Virtual Disaster Preparedness Forum. This forum features expert speakers presenting on data tools and resources, disaster planning communication, and institutional preparedness. Our second session will be Climate Resilience Resources from the Office of the Assistant Secretary for Health. And that's going to happen next Wednesday, September 25th. And you can still register for it by heading over to our NNLM training calendar. And we are going to drop the link for the training calendar into the chat to make that really easy. So it is my great pleasure to introduce the speaker for today's session. Recognized as among the top 100 most influential people in healthcare by Modern Healthcare magazine, Alan Morgan, MPA, serves as Chief Executive Officer for the National Rural Health Association. He has more than 34 years of experience in health policy at both the state and federal levels, and he is one of the nation's leading experts on rural health policy. Mr. Morgan has served as contributing author for several publications, including The Handbook of Rural Aging, Rural Populations and Health, and Policy and Politics in Nursing and Healthcare. In addition, his health policy articles have been published in the American Journal of Clinical Medicine, the Journal of Rural Health, the Journal of Cardiovascular Management, and Laboratory Medicine. Mr. Morgan served as staff for former U.S. Congressman Dick Nichols and former Kansas Governor Mike Hayden. An additional past experience includes tenures as healthcare lobbyist for the American Society of Clinical Pathologists, the Heart Rhythm Society, and for VHA Incorporated. He holds a bachelor's degree in journalism from the University of Kansas and a master's degree in public administration from George Mason University. So welcome, Alan. Really looking forward to your presentation today. I am now going to turn off my camera and then I'm going to turn the screen share over to you.
Thank you very much, Erica. I really appreciate that. Let me get my PowerPoint up and started. Without a hitch. Fabulous. I got to tell you, I appreciate joining all of you this afternoon. And I can't remember a time where I've ever been this excited to talk about such a terrible topic. And let me explain a little bit on that in particular. At the National Rural Health Association, we cover the waterfront of healthcare when it comes to small communities across the U.S. We talk about workforce shortages. We talk about declining life expectancies. We talk about providing healthcare in a quality setting and to a population that needs this healthcare access. With all of these topics, it always surprises me how much this topic of cybersecurity is simply dominating my everyday work recently. I would hazard a guess probably 2 to 3 discussions every day is on the topic now of cybersecurity. And I've lost track of how many conversations, presentations, and meetings I've been to on this particular topic. And so it's nice for me to have the opportunity to hopefully distill that for all of you at this point. I am happy because I will be providing tools, resources, and a framing of this overall issue. So that's great. That'll provide what you've been here for. But I'll be honest, it's going to be a little bit of therapy on my half because despite all of this discussion on this topic and it being a top tier issue when it comes to rural communities, I'm not going to be able to provide you with a silver bullet solution today, unfortunately. So we'll try to do that the best that we can. Now, a disclaimer before I begin on this. I am CEO of the National Rural Health Association, so I'm going to be providing you with an overview of this particular issue and how it's playing out across the United States. I'm going to be providing tools and resources. In specific, I'm going to be talking about a couple private sector resources, one from Microsoft and one from Google. It's important to note I am not an information technology expert. So as such, I will not be telling you what port to plug in the Ethernet cable. And I'm not an employee of either one of these private firms, nor do I have any financial interest. So I'm not going to be, it's not going to be a sales pitch. That's the good news. The bad news, it's not going to be a sales pitch either. So I'm not going to be able to talk in specific about their products and services. That being said, I will be able to give you my take on those and other resources that I share with you during this presentation as well too. So the goal at the end of this is that we have a shared understanding of this particular issue as it plays out, and also you have resources and tools to share when it comes to this particular issue. So let's hope we get there by the end of this. Let me start with our membership map. The National Rural Health Association, we are a membership organization, and this map represents the more than 22,000 of our members across the U.S. I hope that everyone can identify your dot on this map. It's not the purpose of this map. What I want to share with this is it gives a great representation of rural America across the United States. And I say that because, believe it or not, the federal government across all of its agencies has more than 72 different ways of defining rural America. It matters. Definitions do matter. I happen to think our membership map is one of the best representations of where rural America actually is. And I say that in particular because you will see where you would expect a lot of our members to be out in the Western U.S., that there's not a lot of dots. And just as a point of reference, that's because 90% of this geographic area actually are federally owned lands and people don't actually live there. But where you see those dots out there are where those small towns, small communities, small clinics, and small hospitals currently reside. So let's first have a shared understanding of rural. And some of you may not be in a rural health environment. That's okay. Let's start with just the rural environment. And I love this particular slide because it does such a great job of portraying the challenge we have when we talk about rural policy. And this certainly is going to come into play for our discussion today. On this slide, you see the beautiful picture of the father and his daughter, and they're looking at a beautiful sunrise in the future of rural America. And what do they see? Workforce shortages, vulnerable populations, and chronic poverty. That's the challenge for us. How do we tell an authentic story of rural America? Because every national media article you see on rural either paints it as a utopia where everyone wants to move to, or a dystopian geographic area where everyone's trying to leave as quickly as they can. And The truth lies in between, and it certainly comes into play when we talk about the policy issue of cybersecurity. And I would say, yes, we do have challenges in a rural context, but those challenges drive innovation. And certainly in the field of healthcare, every major innovative approach to healthcare that we've seen over the last 30 years has its roots in rural communities, rural hospitals, and rural clinics. I mean, we're talking about whether it's the innovative approach of using community health workers or patient navigators or even telehealth, which obviously has its roots in a rural context. So that being said, I think we're seeing some innovative approaches to dealing with all issues, and certainly cybersecurity in a rural context as well, too. So as part of laying out the context here, any presentation on rural America, you get to this particular slide. The slide that highlights data-driven that rural is older, sicker, and poorer. This is what makes this geographic location unique. Older, sicker, poorer. It's what drives policy and drives politics as well, too. This is a very great and easy to use elevator speech on rural America, but it's a terrible recruitment tool. And in the issue of cybersecurity, and I'll touch on this later, workforce and workforce shortages are front and center. Oftentimes when we talk about workforce shortages in a healthcare context, obviously what comes to mind is the shortages of medical specialists, of generalists, and nursing professionals as well. But I got to tell you, when it comes to cybersecurity, this lacking of IT technology specialists in a rural context certainly comes to bear as well, too. And I'm going to highlight some of the ways that we're going to be addressing this as we move forward. Okay, that's a lot of bad that I've shared with you about rural, but let me hit the other context on this. And I just want to share 3 particular research articles that I hope in the future you have a time to take a look at, because it tells a different story of rural. And the first one being the University of Minnesota's age-friendly research. I love this research because what it does is it highlights those parts of rural America that are in effect blue zones. Now, they don't call them blue zones because there's copyright infringement issue there, but what they are blue zones. They are areas in rural communities where people are living longer, healthier lives than what would normally be expected. It happens in rural, and we don't tout that success enough. And it happens because of this sense of community that we have in rural America, the ability to get outdoors, and in many cases, garden, walk, whatever you may have, and this networking ability that rural communities have. It is an asset-based approach to looking at rural and rural health. The second research I want to highlight, if you haven't had a chance to take a look at, is the Appalachia Regional Commission's Bright Spots research. And you can easily locate this by Googling this. The Appalachia Regional Commission took the data that they had on economic status and overlaid it with health status, because as we all know, health equals wealth, except when it doesn't. And what this data showed were there were pockets of rural America with historic and long-standing poverty that nonetheless had great health outcomes. Again, demonstrating that this concept of rural being poor or left behind or forgotten doesn't always fit the mold that we expect, and there are success stories here among them. The final point that I want to highlight before we get into the cybersecurity discussion, the heart of it is the Institute of Medicine's Quality Through Collaboration, their landmark study looking at quality of healthcare in a rural context. The IOM found in their study that rural actually has a competitive advantage over urban providers when it comes to delivering high-quality healthcare services. This is because of the propensity to be able to network and collaborate with each other that you see in a rural context that you don't always see in an urban context. So again, I just want to make sure that we highlight and we have a right perspective as we go into it. Yes, we have challenges in a rural perspective, but these challenges drive innovation and unique approaches to solve these problems. Okay, let's get into the heart of the discussion right now, and that's the issue of what we're seeing in rural cybersecurity today. Now, the first point on this highlights the fact that from 2022 to 2023, cyber attacks rose 128%. Not included on that is the prior year of 2021, where we saw an 84% increase in cyber attacks. Those are the two data points that we currently have. We do not yet have the 2023 to 2024, but it just articulates what we all sense is actually happening, is that while cyber attacks and cyber security has been a longstanding issue when it comes to healthcare in particular, there is a dramatic increase in this, in the prevalence of it that's happening. In fact, just last year, 88 million patients saw their personal data, healthcare data, exposed as a result of these cyber attacks, which is a 60% increase from the prior year. So what we're seeing in particular is that rural is becoming increasingly a heightened target when it comes to cyber attacks. And it's not necessarily in the past, as we've seen these perpetrators looking to extort large sums of money. Where they're really seen at this current stand is rural is becoming an increasing target because they're seen as soft targets and easy access to the patient medical records. In fact, the money received from access to these patient records sometimes can supersede the amount that they would have been able to extort from a facility as a result of that. And let's be honest, a large health system or a large corporation, an amount of money that can be gained from that, you're just not going to have that in a small rural clinic as a result of that. Now, the challenge here, of course, is the high cost of these healthcare providers to actually address these breaches when they actually occur. Oftentimes limited or conflicting guidance from government agencies on how to address this after the fact, and this limited funding and infrastructure and resources they see as a result of this. I'm going to say this again as we go ahead, but unfortunately, still today, there's this perception that the rural providers are to blame when this happens, or somehow responsible when this happens. And that creates a twofold problem. One is being able to work with federal agencies in a collaborative manner, number one. Number two, the public perception as a result of this. Public perception drives public policy. And a challenge I have is being able to identify hospital CEOs or clinic administrators who are willing to talk to the media to share their story, again, because of this perception that somehow they did something wrong when they've been attacked. Earlier this year, we saw the attack on Change Healthcare, which is a tremendously large entity that, despite their best efforts, saw their systems attacked. And one thing I stress all the time in policymakers is you can have companies and corporations with really limited funds not being able to stop these cyber attacks. So most certainly a small rural hospital or a small clinic is not going to have that sort of infrastructure to be able to address it. And that's why, from a rural perspective, from our members that we talk with, so often we hear not so much of how do we prevent this, but tell us how we address this once it's happened. What are the next steps? What are the resources available once that happens? So let's really quickly, just for the record, cite what we're talking about when we talk about rural providers. Nationally, there are about 600 federally qualified community health centers out there. Rural health centers. Rural health centers are not the same things as federally designated rural health clinics. There are 5,000 rural health clinics. So just for reference again, community health centers, that's a federal program. These are entities that are designed and paid to be able to treat and address the healthcare needs of low-income individuals. Rural health clinics are what you would expect, a small town doctor and their clinic. They maybe have a clerical staff in the front, really small entities. And the vast majority of these clinical touch points out there are, in fact, rural health clinics. In the world of rural hospitals, there's roughly about 2,000 rural hospitals out there, 1,300 of which are known as critical access hospitals. Again, this is a federal designation. They're small 25-bed or fewer facilities. They do inpatient, they do outpatient. And now there's actually, this says 18, rapidly going up to 60 rural emergency hospitals. This is a new provider type. These are hospitals without inpatient beds. These are just outpatient hospitals. They are hospitals, 24/7 emergency room service, but no inpatient care. I say that because as I move forward, a lot of the focus is how do we address the cybersecurity issues of these smaller critical access hospitals and then these small rural emergency hospitals. These are the smallest of the small out there. Now, I'm getting in the weeds a little bit here, but there are 500 what's known as prospective payment hospitals. These tend to be larger rural hospitals, usually in the range from about 25 to 100 beds, the larger facilities. Okay, one of the challenges we have is this rural hospital closure crisis that we're seeing out there. And there's a lot of factors behind this, but I just want to point out, if you remember earlier, I showed you the membership map in the NRHA and the high concentration of rural communities, in particular in the Southeast. In the Southeast of the United States, we see, if you're looking at any measure, diabetes, hypertension, obesity, and you match it with these hospital closures, you'll see that the shape of these maps actually overlay each other. And the problem is we have in the Southeast in particular, these small rural towns we've clustered in patients with really high health needs and many times do not have the ability to pay for their healthcare costs. And as a result of that, those costs are being placed on these rural hospitals. So in a time where the rural hospitals are trying to make sure that they have the financial wherewithal to ensure that they can protect against cybersecurity threats, they're also just simply trying to keep their doors open and continue to deliver services going ahead. Okay, now we've moved straight into the topic of what happens to these small rural hospitals and clinics during these ransomware attacks. And I want to point out that my staff has thankfully put on this slide the word may. Disruptions of similar rural and urban magnitudes may be more detrimental in rural. I get that. You know, every unique situation is unique. Every rural community may experience a different type of cybersecurity. But I'm going to say right now, when you're looking at national data, clearly these cyber attacks are more detrimental and have a greater impact on these small rural communities for several factors. And that's the reason why in the last few slides, I drug you through that discussion of provider types and what these rural hospitals do, because you see in a rural context, outpatient volumes are much higher than in urban context. Urban providers generally have more inpatient patients than rural patients. So when you see the situation that you see in a dramatic increase in outpatient visit declines, in a rural context, you can see the actual financial impact that this has is much more for these rural providers, number one. Number two, what we really all care about is what does this mean for the patients? And in a rural context, shutting down a clinic or a hospital where the nearest rural clinic or hospital may be 30 minutes or more, that magic time of 30 minutes where you need to be within a 24/7 emergency room service, presents a real and present health emergency for these facilities as they go ahead. And I think in particular, this is the reason why this discussion was included in this series of responding to emergencies and public disasters as they occur. We should, as a nation, be viewing rural cyber attacks on healthcare facilities as national emergencies and crises. So as a result of this, the obvious question is what needs to happen? And This is a great resource. I've included this. You'll have a copy of my presentation, but it gives a link to our National Rural Health Association's Cybersecurity and Rural Health Policy paper. This is a great cheat sheet for everything I miss in my presentation or anything you didn't catch. This is one-stop shopping where we outline the situation, the problem, backed with data, and recommended policy solutions going ahead. I'm going to take a little bit of time just to walk through these because I think they're really important. First and foremost, there needs to be, and there currently is not, regional cybersecurity support centers. The ability for once these things happen for a clinic or a hospital to be able to call up that support center and say, we've been attacked, we're trying to respond to it, we're trying to get our systems back online. What's the next steps? What do you recommend? That resource currently does not exist. There needs to be better cybersecurity education and training for both the clinical staff and also the administrative staff in these small settings. This concept of information sharing, like we're doing right now, needs to be elevated. At the end of the day, when I talk with our members, whether they be in clinics or in hospitals, the top tier issue is this increased funding. A lot of times we talk about how to prevent this. I can tell you again and again from a rural hospital standpoint, the great concern is this rapidly increasing cost of cybersecurity insurance. It is exploding at such a fast clip with no insight there that at some point very soon, it's either not going to be offered to rural clinics and rural hospitals, or it's going to be unaffordable for them to have. And this insurance is that financial safety net which protects them after this has occurred. This is yet another great parallel between what we're seeing in natural disasters. Flood insurance is a good example of that, where we know they're going to happen, and do we have a safety net for those communities afterwards to be able to rebuild and get their a community back on schedule. That same approach needs to be adopted at the federal level, but it hasn't happened yet. And I can't emphasize the need to enhance internet connectivity. Now, what does that have to do in a rural context? And some of you know immediately, but just for those that may not, being able to have high-speed internet access and for clinics and hospitals to afford cloud-based services provides that extra level of security that they may not have if they're keeping their patient records only stored there locally. So again, resource number one, providing to you this policy paper on cybersecurity in rural America, which has the resources, data, and policy areas needed going ahead. I talked a little bit about this in the past slide, but now I want to go a little bit more down into detail on this. Currently, there's not an alignment of standards or requirements or resources between the various agencies that have to come into play on this, which I know sounds a little bit crazy, but it just hasn't happened yet. And this is really at the federal level. There needs to be more discussion across agencies about making sure that the alignment of standards, what's required, what's needed of these healthcare providers is aligned and together, and that they're working together as well too. I mentioned the rural-specific resources, technical assistance of trying to improve the status of the educational status of the employees at the facilities. That's really important. And I apologize, I use some acronyms here. So let me get through these. State Offices of Rural Health. In all 50 states, there is a State Office of Rural Health. They're a combination of state-funded and federal-funded. In your state, you can Google this, and these particular entities provide additional educational opportunities. They're great resources. And on the issue of the federal Rural Medicare Flexibility Program and Small Hospital Improvement Program, these are two federal programs that are run out of the Federal Office of Rural Health Policy, federally funded and have grant funds available for local providers. So what I'm talking about, both with the State Offices of Rural Health and the Flex and SHEP grant programs, are funding pools that providers can access. So if people ask you, where can we get funding for this? These are three particular funding buckets right now, which can be accessed through this. It's not enough, but it is what's out there. And I think part of the policy development process that's going on right now, if you're following on national news, you hear that Congress is talking about a continuing resolution to keep the government funded, or are they going to do an omnibus a federal funding bill at the end of the year? That may seem not impactful at the time, but that is directly what this is engaged in. And actually, we're working with policymakers on Capitol Hill and the White House right now to increase the funding levels within this discussion for these particular programs going ahead. And in addition to that, I just wanted to highlight, lots of times people want to know, well, is there any legislation out there currently that would, in addition to appropriations? Yes. Senate Bill 1560 at the federal level, the Rural Hospital Cybersecurity Enhancement. This is particular federal legislation that would, in specific, what I like about this particular bill is it provides funding and resources for local community colleges to really partner with healthcare entities in the local area to develop programs for in-house IT professionals to help address this issue. All right, so this particular slide is one of those checkbox slides. You're probably going to want to hear from me. What are some great federal resources to address this issue? Well, here you go. I encourage each of you to go on to these different federal sites to look, because they are resources for cybersecurity, and tell me what you think about them. When I read them occasionally, they'll have the word rural mentioned once, twice, maybe three times. They're really not specific to small rural facilities that have a lacking of workforce and lacking of funding for them. So they are the resources out there. That's what I want to provide in this. But I'm openly critiquing them and saying I hope that as we move forward, they're more tailored to rural. But this is the public sector resources available to this particular topic at hand. Which turns to the other aspect, with knowing the public resources, what are the private resources? And this actually spurred the discussion of having this particular educational content today. And that is, earlier this year, in conversations that I had and my team had with both Microsoft and Google, in conjunction with the White House and the American Hospital Association, we were able to pull together resources in the private sector to be able to help these small providers going ahead. So I do want to talk about this. I think the biggest thing to come out of this was it elevated and highlighted the unique aspects that rural providers are facing in this, number one. And number two, as I mentioned, it does provide targeted tools for these providers going ahead. And let me talk a little bit about these. So this does give tremendous discounts. I'll talk about Microsoft first on their security products. And I want to be clear for this. Again, goes back to my earlier slide on provider types, because provider types matter as well too. So these discounted and provided services are only for critical access hospitals and rural emergency hospitals. And again, they're intended for the small rural hospitals. If you've got a town of, 2,500 to 5,000, that's probably where you're going to see these type of facilities out there. I say that because I've been getting a lot of calls from national media. Why has only 320 rural hospitals availed themselves of this? There's 2,000. Why is only 320? Well, in particular, these particular programs are not available to hospitals that are part of, affiliated, managed by larger health systems. The concept being the larger health systems have the resources to be able to pay the full amount for these products and services. Again, these are most likely these independent rural hospitals in small communities of 2,000 to 5,000. If you know rural communities, these are usually 1 to 3 stoplights, maybe a blinking stoplight too. So it does have, as I mentioned, some of the particular security products. But I got to tell you, this is where I'm really happy about on this, and I think really does matter, is that this particular program will provide free cybersecurity assessments for these facilities. Now, I do not have the particular data nationwide on how much these private assessments occur, but they are necessary, number one. Number two, it appears from my perspective that they range from $10,000 up to $20,000 for these assessments. So from a small hospital, this is a lot. This is a lot, and this is being provided free of charge for those particular hospitals. And really, really good because, in fact, for the last 5 years, we've been trying to get the federal government to foot the bill for $20,000 for each one of these rural hospitals to be able to afford this assessment. It's really, really important to be able to see where are the potential holes that you need to fill to protect your community. I hope that makes sense. Okay, now we're going to talk about artificial intelligence, and I'm gonna do a hard stop on this particular topic. And I know we don't have for the people who are on the call today. Not all of you are in the healthcare sector, so I'm interested to see how this plays out in other sectors. But I can tell you, with the emergence of AI back in the fall of 2022, when I started getting calls from national media asking about how is AI playing out in rural healthcare, and even I at that point was laughing. And our members were laughing. It was not playing out. And there was that snicker effect. And even up through, I would say, March or April of this year, we still had that snicker effect. This year, we brought in rural hospital members, I think, for face-to-face discussions on this topic 3 times. The first 2 times they snickered. When they were here last year, there was no snickering. And it's amazing to me how rapidly this technology is infusing itself and going from what may be to actual what is. And I wanted to share that in particular with you at this time. AI is being employed in rural healthcare now. And I think going ahead, well, one, the potential that AI is being used by insurers to direct or deny particular coverage, that's a particular issue in AI for healthcare in a rural context. But the potential for AI to be able to be an affordable tool to safeguard these rural providers is real, and it's rapidly developing. At the same time, the potential use of AI as a nefarious agent to enhance cyber attacks is real, and it's only going to get worse going ahead. I've been engaged with rural healthcare policy for 30 years now, and every year everyone says, well, this is dramatic changing times. This is dramatic changing times. And in the next 12 to 24 months, the role of AI in cybersecurity is going to be a top tier, rapidly revolving issue that literally will likely change from week to week. So as you move forward, just put a placeholder on this and know, both from a safeguard standpoint and from a tax standpoint, it's going to be tough to keep up with this particular issue. Okay, so who is available for this Microsoft? I mentioned earlier in general. This is another. Earlier I mentioned the Federal Office of Rural Health Policy. It resides within the Department of Health and Human Services. A particular agency within them, Health Resources and Services Administration. And they have a definition of rural that's utilized for this particular one. It has to do with geographic commuting areas, rural urban commuting areas, RUCAs as we like to call them. So that is the definition of rural that applies. Rural urban commuting areas, RUCAs effectively known, promulgated by the Federal Office of Rural Health Policy. Wow, that's a lot. I hope that wasn't too confusing. As I mentioned, urban hospitals are not eligible for this. And I would say this is the easy part. This is the actual screenshot of Microsoft webpage where you can get this. Again, I'm not an employee of Microsoft, but it's pretty straightforward. You can send this in. What I would encourage, if you are thinking about doing this yourself or you're recommending this site to someone, make sure that after they do this, if they are denied, that they pick up the phone, they actually call Microsoft, because defining rural, I hope I've done a good job of explaining. Defining rural is really one of the most complicated things we do. in federal policy. And so you want to make sure that if you are initially denied, that you speak with someone in person and that you make sure that you actually are not qualified for this particular program, because it is such an important resource for those rural hospitals. So now let me shift to the other option out here, and this is the Google services. And I'm going to be doing a lot of editorializing on this because, again, I'm not an employee of Google. I've had many more personal discussions with Microsoft ramping up to this and making sure that this is rural relevant. I haven't had as many, and my team has not had as many personal discussions with the Google program. But that being said, so let me try to caveat, I think this really is a great resource. And I want to be clear on this. I think it's a great resource because in particular, it has these training modules. And I think they're relevant and important and a useful tool for hospital or clinic staff to be able to be certified in this. I think it's a great tool. It's not rural focused. And I will just say that I wish they do a better job on the rural language. But maybe it doesn't need to be in this particular case. I hear good things from our members about those that have actually utilized these educational tools for Google, number one. Number two, let me see if I have one more slide. No, I didn't have one more slide on this. A lot of the Google initiative into rural is things to become, this pilot program. So I think we'll have to wait and see as we move forward where this ends up. I want to make sure I'm clearly articulating this. I think that the training sessions being provided are a great resource. That's what I hear from our members right now. I don't think it's particularly rural relevant, but maybe it doesn't matter. And finally, I think there's a lot more to come in Google as a resource yet that still hasn't quite made its way there. So I hope that makes some sense. So the two discounted nationally private sector resources, Microsoft, Google. Microsoft, you really have to be well-defined to be able to access those. You have to be a rural hospital and specific. Google, not particularly rural, but nonetheless, they're moving that direction. So I provided at this point you the federal resources, the federal websites, the funding resources, and what we hope to see coming in additional funding as soon as you hear word about Congress approving funding going forward. Make sure you either check with the National Rural Health Association or maybe your state hospital association or your state primary care association. They're all going to be sharing this. It's our hope and expectations that additional funding is coming as a result of this. And again, here's a direct link to some of these Google products that we've talked about and how you apply for them in particular. So that being said, wow, I am absolutely right on time of what I had hoped to be. Let me do a little summation here of what I wanted to accomplish. Number one, hopefully it's clear. There's no silver bullet out here going ahead to prevent this going forward. Two, hopefully it's comforting to you just to know this is it. This is what's out there. So good or bad, if you think you're missing something, you're not. This really is. Talking with our members, our rural members, I can say the peer-to-peer conversations are really most valuable, where you have it at the state level and you have clinics talking to clinics and they're sharing their stories. Again and again, that's something as an educational nonprofit institution that we are at the National Rural Health Association, we're trying to promote as many of these peer-to-peer conversations to happen as they possibly can. I want to go back to, we need to, from a policy perspective, we really need to change this as one of healthcare providers not being the bad guys for something they didn't do on this, but actually being the victims along with our patients. And how do we change that perception and realize that this is a tremendous role for federal and state entities to partner with these rural providers going ahead. And then finally, I want to go back to that. Don't hesitate at the end of this. If you just go on any search engine, Google, Yahoo, Bing, type in the words rural health. That's all you need to remember. And our website is usually the first, second, third website there. You can look on our policy paper and see resources at that point and additional resources online for this. So with that, I hope this has been what you would expect it to be. I hope it's been educational. I hope it's been helpful. It certainly has been therapeutic for me to hash out all this. So Erica, I'm going to turn it back to you this time. Be happy to attempt to answer any questions that might have come up online. I'll stop sharing my screen.
Yeah, great. Thank you so much, Alan. We do have one question that came into the chat, and Denise stated that a lot of smaller rural hospitals are being bought up by larger organizations. Will this help or hinder combating cybersecurity?
The correct answer is yes, no, and maybe. And let me talk about this. I think the consolidation in the healthcare system is going to continue and going to accelerate, in particular because of the cybersecurity. That's a pretty bold statement to make. But that the only other option, we're seeing a lot of small hospitals and clinics form networks and networks of other rural providers, and that allows them to continue. And I say this because I can give you 100 good examples of large urban systems purchasing rural healthcare and keeping healthcare local, and they're great success stories, and they actually provide that. But the concern that we always have is local board control is really important to know what is actually necessary in that community. And anytime you lose that local board control, then whether to maintain an access point oftentimes becomes a financial decision and not what is best for the community. So to answer your question directly, this is driving the acceleration of consolidation within the healthcare system, one. Two, it's not always a good thing. But three, this does provide in certain circumstances that access to capital and technical expertise necessary as we move forward on this.
I mean, we did have a follow-up question submitted too. So when you talk about how only 300 or so rural hospitals qualified for private funding, it made this person wonder, are larger hospital entities protecting their rural hospitals enough? And how can they do better to protect their rural assets? And how could your organization help with this?
Yeah, I certainly hope so, right? I mean, that is an unknown question, is how is each health system serving as that guard point on it? And I would like to think that that is occurring, because when these smaller rural hospitals, if they are affiliated and owned by larger health systems, they share the same electronic health records, EHR systems. And so it's incumbent upon them to do that. And most importantly, for these large health systems, they have to know, in what I shared at the beginning of this call, is these are, it's not randomly happening. Rural providers are being particularly targeted because they are seen as easy marks. And anytime you see that, you know that they're going to happen. And in fact, just hearing from some of our rural hospital CEOs how many times a day their systems are attempted to be breached is outrageous. So I hope that is the case. I have no data to back it up, though.
Great, thank you. You know, I was just curious about what is the status right now on that S-1560 bill?
Well, if you've been following Congress right now, you've been following Congress right now, so you know that not a lot is moving forward. I think that's the most positive way of saying that. What we are hopeful is that portions of that particular bill will be pulled out. And in a perfect world, boy, this is getting inside baseball. In a perfect world, Congress actually does what's known as an omnibus bill in December this year, and they will pull parts from that legislation and put it in that massive funding bill to get it out the door. I think Congress is well aware of what a significant threat to rural residents and to healthcare this is. When you shut down a hospital emergency room in a rural context, this actually is costing lives. So we're optimistic that Congress does move forward with an omnibus bill in December, and that this is included.
Great, thank you. I'm not exactly sure of the breakdown of all of our attendees here today, but I do know that we have both health sciences librarians and public health professionals. And obviously we're not IT specialists, but can you think of some ways or recommend some roles that each of those professions could take in contributing to cybersecurity and assisting their organizations with protections?
Yeah, yeah, yeah. One of the things we hear about, and this all, you always, as I mentioned in that opening slide, to try to get beyond the myths of what rural is. That being said, one reality is most of the IT professionals in small clinics or rural hospitals are either, quote, the CEO of themselves, or they are someone that has graduated from a community college certification program. And so regardless, if you're not in a healthcare setting, just to be able to hopefully share the links that I've shared as a resource and say, okay, I did hear this presentation. Here are the federal resources. Here's where you get more funding for this. And here's some private sector options available. I think that's the best you can do, just sharing that information. And again, I am hopeful everything I said today may be irrelevant tomorrow if they come out with some new AI product that is super affordable and can be rolled out immediately to help safeguard these facilities.
Awesome. Thank you. Oh, let's see. I think just as soon as I changed my screen view, another question may have popped up. Well, we've got part of a question in there. Oh, here we go. Here's the rest of it now. Do you have any examples of how AI has been used in cyber attacks? Specific examples?
I do not. How's that? I think, no, I do not. And I hope I did. I hope I did a good job setting that up of how quickly we went from people snickering about this to taking it gravely serious. And I really think this is a unique moment in history over the last 3 months where at least our members have started to realize, oh, this is a serious thing, and this can really be a game changer. And I say that because not only you saw on the slide where Microsoft now provides that AI as an opportunity to be a safeguard in it. And I haven't checked out that product, and I haven't had the demo on that because that's fairly new. But you also just wonder how nefarious agents. And I would say this again, I wish that there's a lot of data that's not out there. And I always make sure I reference the data and what's peer-reviewed research and what we know to what our gut tells us. But so many of our members, you have to think a lot of this appears to be driven by state actors who are well-funded to be able to cause this disruption. And a state actor that's willing to fund this also has the wherewithal to employ and engage AI into this, which may be much more. So I wish I had specific, but this is one of those real-time experiences that are happening as we speak.
Yeah, definitely. We'll all have to watch out for examples of that to be able to share with the rest of our communities. Alan, thank you so much for this conversation today. I would like to encourage everybody who attended to go to the NNLM website. We do have an emergency and disaster resource guide that we've compiled there. It's a collection of resources and tools that are relevant to disaster and emergency management. And given the topic of today's presentation, all of you may be interested in attending NNLM's Rural Health Webinar Series that will be happening in November. We've got a number of sessions running from November 6th through the 21st. You can learn all about the series and register for the sessions on the NNLM training calendar. We are going to be sharing the link for the class evaluation in the chat. And then just that last reminder again, that in 1 to 2 weeks, you'll receive an email from us with a link for the recording for this session. So thank you so much, Alan, again. And thanks to all of you for attending today. And I hope you all enjoy the rest of your afternoon.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.